This video will discuss government healthcare programs, focusing on Medicaid and Medicare expansion. We'll explore the impact and considerations surrounding these important programs.
Good afternoon. My name is Alejandra Reyes, and today's discussion is regarding healthcare programs, Medicaid and Medicare expansion. Government spending on health programs, specifically Medicaid and Medicare expansion. These programs are designed for low-income individuals, seniors, and people with disabilities. Expansion means illness, earlier diagnosis and treatment, better chronic disease management, including diabetes and heart disease, reduced use of emergency rooms, and an overall improvement in public health outcomes. According to the KFF, the independent source for health policy research, polling, and news, Medicare and Medicaid CHIP accounted for 20% of the entire federal budget spending in 2024. Medicaid and Medicare differences. Medicaid is a joint federal-state program for low-income individuals, families, and people with disabilities. On the other hand, Medicare is a federal program mainly for people over 65 years old and some younger people with disabilities. The opportunity cost of expanding Medicaid and Medicare is what the government gives up in order to fund it. Since the government has a limited budget, spending more money on healthcare means less money is available for the other areas. Other areas are such education, infrastructure, and national defense, amongst others. This is important because Medicare is not very accessible to very low-income families, to rural families, to elderly individuals, and this program is specifically important because it includes prevention and wellness resources. Some of these resources are offered by the HHS, the Health and Human Services. You might be able to find really good resources on their website, and it's in my source page. So these programs are very important, and they're part of the healthcare programs and include nutrition and fitness, health screenings, mental health and substance abuse services, the environment and your health, healthy lifestyles, preventing health services, vaccines and immunizations, which were very important during the COVID-19 pandemic. And there is also work in prevention and wellness programs, amongst others that you will be able to find on their website. Scarcity, government healthcare expansion trade-offs. Some of the benefits that this includes, it's more people insured, better access to care, improved health outcomes, and reduced financial risks for those in need. Medicaid expansion had increase in coverage and federal spending as well in 2021. As you can see on the right side, the graph shows that the eligibility and the enrollment went up from 2017 through 2025. This was mostly because of the subsidies that were given to taxpayers. Unfortunately, these subsidies will go away in 2026, but it will still be a good deal to get this type of plans through the government. The cost for the government is, of course, higher government spending, higher taxes, maybe increased deficit, budget pressure long term. Long term sustainability depends on cost control, demographics, and policy choices. In a world of unlimited wants and limited resources, trade offs are unavoidable. So, those in charge must make difficult choices about how resources are used. and this is left for the decision makers. And I leave you with a quote from Brian Stevenson. Public health begins when all of us recognize the humanity and dignity of every human being, quote unquote. Sources page for you. And I thank you very much for listening to my presentation. I hope you enjoyed it, and I hope you find some helpful information included on here. Thank you so much. Good night.